Healthy Regions is a contributory organization of the Ministry of Health of Slovakia. And as such, we are focused on increasing the conditions of health of people living in excluded, marginalized Roma communities, and we are focusing on social determinants of health. And to do this properly, we are a participatory project. That means that we have almost 300 Roma health mediators situated in respected communities. So what's our main role is to reach the people in the communities, motivate them to join the project, to explain them every step of the project, and we are responsible for all the fieldwork, for organizing the awareness session, for contextualizing the questionnaires. In some cases, we were responsible for making amendments to a few PR materials, and in some cases during the awareness sessions, we were also our mediators did also some cultural translations of the information people received from the doctors.
So when I'm talking on behalf of Healthy Regions, the main contribution is also lies in awareness session that actually took part among the locations we chose for this project. Also for our health mediators in the field, because our employees are searching and reaching for more and more information regarding so they can help their clients with their health issues they might have. Also what is the great importance of this project is the possibility of self-testing of the clients in their homes, in their environment they are used to be. I really appreciate also the personalization of approaching these clients and delivering them the outcome, the result of the self-testing.
For us, it's very crucial that the person who is employed as a Roma health mediator is a person from the targeted community. He knows his neighbors or her neighbors very well. He knows the language, whether it's Hungarian or Roma language, Slovak, of course. We need this person to be an honest person willing to serve his or her neighbors 24/7 in some cases. Is also able to cooperate with healthcare providers, with other helping professions in the community, and also with the municipalities. So we need people who are willing to be trained, who are willing to push their boundaries. In some cases, and people who are not in conflict in anyone in its community. So people can put their trust and trust about the health of their children in these people. Our health mediators, they during their everyday work, they do interventions and also health promotion activities. And within these health promotion activities, there is many areas or topics that are related to reproductive health or sexual health and everything connected to this. So it's not really a new thing for them to motivate someone to be willing to go to the doctors or to do something for their health. So when it comes to HPV testing, this is something which is not really really common in Slovakia, because in Slovakia you have during the prevention care at your gynecologist, you have this test, it's cytology test, but you don't have a HPV testing per se. This is some paid service, and as such, it's really not an option for our clients. It costs about 30 or 40 euro if you want to do this in the doctor's office. So this is a very good thing. You can do it at home. Something that will tell you about your health even before something is wrong. So you can ask for help and seek the help very soon. So this is the very big motivation for the clients, that they can do the test in their homes. Yes, it's related with the questionnaires, which can be really tiring, but it's the role of the mediator and the trust they already have that will help clients to that will help client to do this?
So, as was mentioned before, healthy regions have a network of our health mediators. So if the client actually is able to reach their result by the paper, by the post, which is sent, it is sent by the post because obviously when we are talking about these clients, they might have some technical difficulties to reach the result by, for example, message or something like that. So we decided to go by paper forms. And when they read the result, there will be also written what should be the follow-up steps for the client. For example, if you have a negative result, you should obviously get the regular appointment at your gynecologist, but at least you know that you are just fine for now. Nevertheless, if you have the positive outcome, there are follow-up steps. First of all, you need to contact your gynecologist. If you are not sure or you don't have a gynecologist, you can contact our health mediator in the field. He will reach up to your regional gynecologist, he will make an appointment, or he will tell you what to do next. That's why we would like to stress out the importance of the trainings our health mediators actually had, and they actually really well prepare for this project. So any question that might pop out would be answered in the field.
Okay. So far it was very fine, very good. We have awareness sessions which take place in 25 localities. I think the actual people that came, there were about 600 people or so, or 400, I'm not sure now, but it was a great amount of people. And I know that every woman or a young woman that came, she will also tell her families, their neighbors and such. So the interest of the people was quite big. And they are curious about when we will actually start the testing, but I think we will start in the end of this month. I really hope so. As it's nearly 4 months after the awareness sessions, they are not so eager to do it, but they are still asking, so it's good. And so when the first women will take the test and they will see that it's really, it's not doing there any harm, and the test and the results came, it will be okay.
Well, for me, it was a challenge at the very beginning to like better understand what will be the project about, how to approach the communities. I was a little bit afraid how the communities will take this project, because we really didn't want it to be just to be a questionnaire. For me, it was a challenge to actually make a structure how to approach the client, how to follow up steps, and basically to have the one client covered by the last dot. So the last dot should be the visit of the doctor's office. So it was challenging, and what I learned is so much more about the research, so much more about basically the cervical cancer, HPV viruses and these things. And I actually had a chance to meet amazing people in the project, and
These sessions with the doctors are really something what makes the project so complex, and which it's really nice for me to see all the women that came to these sessions. They are willing to share their personal stories. They are going from the sessions with the notion that, okay, I will tell this to my daughter or to my husband, and they will take maybe more responsibility for their own health. This is a very good outcome for me. I also am very grateful to see our mediators and our coordinators to be a part of such a big project, to see how they are patient with all of our meetings and everything, because they want to see the results in the field. They want to give the women the self-test. They want to do the follow-up. They want to help the women. So, I like working on this project, and it's mostly because our mediators and our coordinators, and also because of our team and because of Truni. So